I'm here with Joseph DeFelice, Regional Administrator for the Department of Housing and Urban Development, Mid-Atlantic Region. Thank you for being with us today.
Thanks for having me. I'm pretty excited about the conversation.
In response to COVID-19, the Department of Housing and Urban Development has provided millions in aid through emergency solution grants to cities across Pennsylvania, particularly to support the homeless population. What do these funds go to or provide for these populations?
So this was signed by President Trump on, I believe, April 4th of this year, and HUD tried to make quick work of this. So roughly $3 billion across the country in HUD funding. Specifically the ESG, it was $123 million to Pennsylvania. They could be used for a myriad of things, from building or rehabbing shelters. In the past, they just used them for rehabbing shelters. So there's been some waivers associated with that, waivers and how to use the old funds that were still out there. Also, just certain social aspects, people that may have needed counseling, employment, things like that. Also in Philadelphia, for example, they rented rooms at a local hotel to put people that may have been at risk, maybe people that were in shelters or on the street, put them in a hotel for quarantine purposes and the like. So it was because, as you know, this was kind of a matter of first impression. It's something that we hadn't really seen before. So no one could have planned accordingly for this. So aside from the normal ESG funding or the normal home funding or the normal CDBG funding that the states got, they got this initial influx to help with these kind of issues. And there's other aspects, and I'm sure we'll get to that in a little bit.
Particularly on homelessness, what have you observed about an increase in homelessness directly related to COVID-19?
So I've been in regularly contact with, specifically in Philadelphia, as Philadelphia goes, with Liz Hirsch, from the Office of Homeless Services. And there's been some pop-ups. There's been a recent pop-up along the Benjamin Franklin Parkway, but the numbers have seemed pretty steady from what we've seen. Now, we know that people are asking for more housing assistance, and that's something that'll come out of the federal home program. As you know, Governor Wolf just announced, I think 2 days ago, the $10 million that we gave the state for home. Essentially what that does is that helps people maybe pay their rent or building new affordable housing. Affordable housing's been a word that we've been hearing about for a while. It's been kind of trumped up over the last couple weeks, months around COVID-19. I have not seen the numbers for a spike here. There have been encampments. Encampments seem to pop up regularly. There's always going to be a health emergency. Specifically, what I've noticed firsthand is along Kensington Avenue, where the opioid epidemic has struck very significantly. During these times, it was even, I think, compounded with the fact that there's COVID-19, drug use, and homelessness at the same time. But, I regularly work with the city to have these conversations to find out what they need from us. We're also working with FEMA. Marianne Tierney's the regional administrator at FEMA, talking to Marianne about any waivers that they possibly have, working with some modular developers about some ideas they had for housing purposes. But it seems now that we've kind of flattened the curve and we're moving forward, I think we're going to start to notice a fallout if there is any now.
Of course, during this pandemic, people have had to social distance and work from home. What does engagement in these communities look like in real life for you and housing and urban development, especially during this pandemic?
So on one aspect, it's made it more difficult, but another aspect has also forced us to work a lot smarter, right? So my job, I don't just represent Pennsylvania. I represent Secretary Carson, Pennsylvania, Delaware, Maryland, Virginia, West Virginia, and District of Columbia. One of the things that I've prided myself on over the last 3 years has been to get out in the field and really cover as many of these areas as possible. Not just Philly, not just Baltimore, not just DC, but really getting out to places like Tamaqua, Pennsylvania, or Williamson, West Virginia. And there's a reason I'm telling you all this, because a lot of times people think it's the federal government's job to dictate down. I actually do the opposite. I go out to these communities. We visit 185 counties to talk to people that are on the ground doing their jobs, and frankly, to dictate back up to Washington the way that we can be doing our jobs better. Because cookie cutter approaches, as you know, don't always work. To answer your question, this has actually made us work a little bit smarter. So rather than physically going to these, we've been hosting a lot of virtual roundtables. For example, we're calling them Mid-Atlantic meetups. You can find them on YouTube. You can find them on our Twitter page, Joe DeFelice HUD, or Mid-Atlantic, HUD Mid-Atlantic. You go there, and it's a way for us to talk to our partners. We did a recent one specifically around homelessness with the Veterans Multi-Service Center and the Veterans VLP out in Pittsburgh. Two groups that deal with veterans. One's a little bit more geared towards housing, one's a little bit more geared towards job training, but it's a way for us to engage with those groups. Secretary Carson was in town about a month ago in Philadelphia visiting the Veterans Multi-Service Center to find out what they're doing around homelessness. But it's a way for us to also connect our partners with each other. just last week, for example, I held a roundtable with several of my federal government counterparts from HHS, from GSA, from SBA, and from the U.S. Attorney's Office to find out what everybody is doing around COVID. And it's also a way for us to help break down the silos. One of the problems that people have with government alone is sometimes your local government's not talking to your state government, it's not talking to your federal government, and sometimes your federal government silos aren't talking to each other. This is for a way for us to break down the walls, to have a direct discussion with the people that we represent, to show that how we're working together, not just around homelessness, around opportunity zones, around things that can kind of move, not only the federal government forward, but the state and local governments and our constituents forward as well.
And in those conversations that you have with your partners and people on the ground, what are some of the biggest concerns that people have in regards to housing in their urban environment?
Well, there's been many issues. One, as you mentioned, was homelessness. Obviously, it's health and housing. I just finished up a conversation with Ruth Ann Norton, who runs the Green and Healthy Homes Initiative out of Baltimore. I've roundtables with her. We've hosted symposiums together, and she's been ahead of this curve. She's been doing this since 1986, but really people are now, but she was preaching to a small audience, right? The people that cared about it. Now she's preaching to a much larger audience. It's not just about lead, or it's not just about asthma anymore. It's about the social determinants of health and how healthcare and housing really kind of go hand in hand. So those conversations have definitely been elevated. The idea of working with housing counseling agencies. I had a conversation 2 weeks ago with Carolina Cabrera DeGiorgio, who runs not Esperanza, Congreso in Philadelphia, and talking about how they've had to adjust working with some of the poorest folks in Philadelphia and utilizing housing counseling and working with small businesses on PPE loans and things like that. So it's really kind of shifted the way. I mean, before there was the normal subjects, whether it was affordable housing, whether it was housing choice vouchers and the like. This is a way for us. Another thing that we recently did here in Philadelphia, we had to make this announcement virtually, is Philadelphia was just granted $30 million as a choice neighborhood. This is the second choice neighborhood designation in Philadelphia. Norris on the east side of Broad Street, and now Blumberg, Sharswood. That's $60 million from the federal government into those neighborhoods in North Philly. But what people don't realize is the private investment that's going to come in with that as well. It's going to be upwards of hundreds of millions of dollars in private investments into these communities that have been frankly poorly served. They're underinvested in for years. We've also put $30 million into Baltimore, $30 million in Norfolk, $30 into Newport News, and $30 into Pittsburgh in the last 5 years alone. So we're really trying, outside of the CDBG funds, outside of the money we give to housing authorities or multifamily groups, that's something else that we do on top of this is our Choice Neighborhoods initiative, and we think that's something that frankly should be highlighted.
We've seen throughout this pandemic that Black and Latino communities have been disproportionately affected by COVID-19. What are some things that Housing and Urban Development or your partners, like you mentioned, Congreso, are doing to address those specific communities?
Well, they're the ones that are on the ground in those communities. So, the old days of going door to door, that's obviously shifted the way that we do things. So we have to find different ways to reach out to them. So it's one of them has been through social media, whether it's been through Instagram, through Facebook, through Twitter, and the like. Also, we need to also make sure that, we just passed in April of this year, it's April actually every year, working with our team, Melody Taylor, and from our team runs our, FHEO, Fair Housing and Equal Opportunity. We need to make sure for Fair Housing Month that these things are addressed, right? Because there is a pandemic, right? So this creates whole other issues on top of it. And I think it creates, unfortunately, an opportunity for discrimination because people that had been routinely paying their rent now maybe have to miss a month. And we're not talking about people that are in HUD-assisted housing, right? Because HUD-assisted housing, we've passed evictions, same thing with FHA mortgages, moratoriums on foreclosures and the like. But really working with our FHEO partners to talk to those people on the streets, to let them know what their rights are when it comes to housing discrimination and the like. But, going back to what I said previously, I pride myself, I've been to every single neighborhood in Philadelphia and in Baltimore, most of them across Washington, D.C., but it's hitting not only those neighborhoods and those getting out to those rural neighborhoods. We've been kind of impacted. So that's why I'm trying to touch base with the partners from within those communities, but not only tell them what we're doing so they can filter down to the citizens of that community, but also that they can pick back up to us what they need from us. And as we get those in, normally I act as a gateway, being the regional administrator. I cover 7 offices, I cover 5 different major programs, but the amount of inquiries that I've received from the field, we try to work with a quick turnaround. And I think we've been pretty successful over the last couple of months. It's not ideal, right? This world is not ideal, but really trying to work across all populations. Whether it's the elderly population, whether it's disabled population, whether it's different racial populations and things like that, we're really trying to make sure that everybody is served appropriately here.
And as Pennsylvania reopens with the rest of the states, what concerns do you have or challenges do you anticipate having to address as this process rolls out?
One of the things I think we need to address is people didn't know what they needed, right? So April 4th, here comes the CARES Act funding, and a whole boatload of money just came in. We just recently announced what we were going to be doing through CDBG before that. Now there's CARES Act funding. I think from an administrative standpoint, it's going to be difficult to be able to first tell people how they can spend that money and where they can spend it. I think there was an immediate need originally maybe to get people off the street, to find quarantine, to build shelters, to rehab shelters, to build affordable housing. But what happens when there's leftover money, finding ways, specifically rural Pennsylvania? So I did a tour in October this year where I hit 13 rural counties in the northern tier of the state. And the issues that they face in Tioga County and Bradford County and Venango County are different than what they're going to see in Philadelphia and in Allegheny and in and around Dauphin. They don't have necessarily access to gas or electric or sewer, but more importantly, and probably most importantly, broadband. In the world that we're in right now, especially dealing with the rural poverty, broadband is something that's becoming essential, with children not being able to be in school, or college students or people working from home not having that access to broadband. So CARES Act funding will allow those people to access the funds to build those data networks around broadband, but also those other networks as well. So Philadelphia, where it's going to be a little bit more compounded, and Pittsburgh, where it's going to be a little bit more, we're dealing with different issues as part of the rest of the state. And this is a big, diverse state, as you know. So whether it's Southeast, whether it's up in the coal region or in the T in the middle, up in Erie, kind of different up there. Opportunity zones is something that we've been heavily promoting. I don't know if this is going to shift that, if people are going to be holding on to their capital gains a little bit more. But we saw, and specifically in Erie, $800 million in private investment in downtown Erie. I got to give credit to the downtown partnership there that has really found ways to work that money into the nation's poorest zip code, utilizing this. And the best thing about it is it's not federal funds that it's coming in. This is private dollars working within not even a federal program, a federal tax incentive. I know I'm a little off topic there, but I wanted to kind of give a breath of what we're looking at from HUD.
All right, Joseph DeFelice, Regional Administrator for the Department of Housing and Urban Development, Mid-Atlantic Region. Thank you so much for your time.
Thank you. I think this was a great conversation.
After a great victory over Union forces in June 1863, Robert E. Lee marches his army to Pennsylvania. The advancing Confederates clash with General Meade's Union Army at Gettysburg, beginning the most famous battle of the Civil War. Explore our nation's past and the Gettysburg battlefield with the Gettysburg Collection. Become a member to stream the library online. Learn more at gettysburgcollection.com.
I'm here with Dr. Brian Nestor, President and CEO of Lehigh Valley Health Network. Thank you for being with us today.
Thanks for having me.
So to start off, for some background, can you just explain what Lehigh Valley Health Network is and how far it reaches in the region?
Yeah, sure. Oftentimes health systems are described by their revenue footprint. So we're just north of a $3 billion health system that has 6 campuses across the greater Lehigh Valley area that extends up into the Poconos and west to Schuylkill County. And pretty much our southern border is really Bucks County.
And as that Lehigh Valley area reopens, how many cases of COVID-19 are you seeing at the moment, especially compared to the numbers that you were seeing at the peak of the pandemic?
Yeah, sure. So we have in-house right now across the network in our hospitals. We have between 60 and 70 COVID positive patients. Relative to our peak, which was north of 200 to about 215 in the network. This is a wonderful improvement. So we're at about a third or even just a quarter of where we were at our max. And that's a great relief to all of us and the communities we serve. And the trend on the number of new cases continues to go down.
You and LVHN, similar to the whole state of Pennsylvania, have introduced a phased reopening process. Can you describe what that process is and at what point you are in that process at the moment?
Yeah, surely. The state has red, yellow, green. That has a relationship to what we do. I would say that that's largely focused on more routine businesses opening up as opposed to healthcare. So we've, while we look at the red, yellow, green, and where our opening has been associated with those state mandates, we had separately from the state an allowance to go back to work for elective surgeries and cases on April 27th, which is it tracks with the red, yellow, green, but it also is its own independent decision by the state authorities and leadership. It was early March mid-March when we actually were shut down for those elective procedures. So really about almost 2 months, a month and a half, if you will, of being really shut down for anything other than emergencies.
And what kinds of restrictions that were put in place during that shutdown have been lifted as reopening has begun, and what kinds of provisions are still in place to allow the hospital to continue to operate normally while still keeping people safe and social distancing? Yeah,
really great question. So, but for emergencies, everything was shut down. So, for example, if I use surgery as a leading indicator for emergency care, only those surgeries that were most critical or necessary were really being performed. And we went down to about 20% of our normal surgical activity. So you can see it shut down about 80% of activity. And with that, you can imagine similar or parallel drops in diagnostics like CAT scans and MRIs, breast health services and mammograms dropped to zero. And that was it all depended on the individual's circumstance on whether or not they wanted to track with their care plan or not. But clearly, if we look at just breast health services, women made the decision that a screening mammogram, the one that just checks you every year, was not worth getting done and risking getting COVID-19. That scared us a lot because, that's a window into preventative care. And sadly, during these last 3 months, we have seen people just use COVID-19 as an excuse to not track their healthcare plans. And that's been a real problem. We've seen increases in strokes. We've seen increases in heart attacks that we think we could have prevented. And we've seen more cases of people coming to the hospital that need an amputation instead of having a revascularization procedure for a leg. A lot of really sad cases, unfortunately. The good news is, and all of that is understandable in the first few weeks of a pandemic. You really don't know, am I at real risk or not? But as we went on through that period, we learned, wait a minute, we can keep people really safe from COVID-19 in the hospital. You don't need to be scared. And frankly, where we're at right now, we're in a COVID-safe dialogue with our community saying, do not put off your healthcare. Come in. Let's take care of you. We know how to do this.
And how concerned, and if so, prepared are you for a possible second wave of the virus coming in the area?
Yeah, really great question. So back to your other comment and question about phases, right? So while we have red, yellow, green in the state of Pennsylvania, at LVHN, we look at it as phase 1, phase 2, phase 3. Phase 1 for us was the immediate shutdown. Okay, how do we kind of lock everything down and keep people safe from active spread of the disease? How do we change our inpatient or hospital level activity and our offices? We shut down half of our physician offices and combined them into about half the number of offices because we knew people were not going to come in for face-to-face. So we ramped up video visits. We were doing 90 video visits a month. We're doing well over 1,000 a day now. And boy, that's been a great learning for people to understand how to do that. But in phase 1, it was how do we react? That was the first thing, and keep the spread contained. Phase 2, which we are in right now, is actually our recovery phase. We formed an emergency recovery operations council very early in April and said, we're going to come out of this as fast as we can when we're allowed to. and we're going to make a fast recovery. I would tell you that when the announcement came from the state to allow us to go back to providing elective procedures and care on April 27th, our first surgery was May 1st, and we've been busy ever since. In fact, our surgical volumes are at pre-COVID-19 volumes, and on certain cases over 100% of that, because we're working through a backlog of about 5,000 surgeries that were scheduled and then postponed because of COVID. Now, I would say that phase two never really goes away. We're still working on the recovery, but we've also in parallel entered phase three. And that gets to your point. Phase three is, how do we live with COVID-19 going forward? We're a July to June budget year, so we are actively working on those assumptions. And what we've decided is we are going to prepare that COVID-19 will be with us the entire next fiscal year. That would be till next June, a year from now. And if that's the case, what measures do we need in place in order to deliver safe care during that time when people finally are getting back on their care plans?
What kinds of testing is available through the health network, both COVID-19 testing and antibody testing?
Yeah, very, very good question. You know, first of all, COVID-19 testing, we were very fortunate. We have a company called Health Network Laboratories, which services our laboratory needs, but also the needs of many other companies. And also it operates in 3 states with 70 some locations for laboratory service. So we had a very robust platform. We immediately turned that up and turned that on. As you'll recall, nationally, COVID-19 testing was very difficult early on. We actually started early on with being able to do about 90 tests a day, which was not that much because the kits were not available to do that. We're now at the point of doing about 1,000 tests a day, all right? Or having that capacity, and we're looking to multiply that to be able to take care of not only our needs, but the needs of nursing homes and other hospitals that just don't have that infrastructure. So that's ongoing. To date, we have actually performed as of yesterday, 38,351 COVID-19 tests. Right now, the number of positive tests are 6,484. That's a positivity rate of about 16%. But understand, we're now testing all sorts of people, not just people that are sick. So that positivity rate during the acute phase of COVID-19 was about 25%. Now that we're testing more people just to be certain that they don't have it, even though they have no symptoms, now that's beginning to drop down. And I think it'll get even lower as we start to test even more people. On the antibody side, which is a really good question, right now there are a couple antibody tests available, and we are piloting antibody tests mostly on our own colleagues at the moment. And that's for us to understand, do we have a healthy workforce? Do we have individuals that don't think they've ever had COVID-19, but maybe did, and they were asymptomatic? And how do we track their family members and the rest of our staff to make sure we have a healthy workforce to take care of our community? That's when they get to the next generation of antibody tests, I think we'll then be able to extend that and have a whole lot more insight into how to manage populations of people and whether or not they should come to the hospital, stay at home, and how do we help their family members who may have been exposed.
People are very familiar with the role that doctors and nurses and other healthcare workers have played during this pandemic. But what role have you and the rest of your hospital administration played in guiding your whole network through this pandemic?
Sure. Well, first of all, it's a great job. It's a lot of fun because you get to support heroes that are working 24/7. And that's not just the frontline nurses and doctors and PAs and nurse practitioners and staff and respiratory therapists, all the people in the hospital or in the physician office. It's also all the people that are heroes working 24/7 to make sure we have enough medications. Our supply chain is in place. I mean, it's really about 19,000 people all working together, and we're proud to support them. What our administrative group did was we knew that we'd never been in this situation before. We're very comfortable with infectious disease and infection control. We've had a long history of doing a really good job, whether it's with flu tents that have been nationally talked about, or whether it's the largest mass immunization for flu that we do each year, about 10,000 people. We're really interested in that space. However, we have never seen a pandemic before. So what we knew is we needed information that we don't have. So we worked very hard early on to do two things. One, we knew we had to immediately bolster our video and online capabilities to take care of patients because they weren't going to show up unless we could give them an alternative. We did that in about a week, and I told you those results. A lot of people, early on, about 70% of our contacts early on were related to video visits or e-chat or other e-visit type mechanisms. But what we also did is we invested in dashboards. So we created information and aggregated it. So we were really reviewing twice daily for about 60 days, twice daily, new information sets. Everything, do we have enough paralyzing agents and sedative agents in order to take care of this influx of people that are on ventilators? Do we have the supply chain for all PPE and masks? That's an example of one. We also needed to know what was going on in each hospital on each floor. Now you have that information, you look at it somewhat passively each week or each month, but we needed to know real time what was going on, how many people were there, do we need to somehow take this group of workers offline, put them over on the side in order to keep another healthy group of people on the bench if there was spread. So I think what we did is created information. In addition, we also look at a massively sad impact. It's like a meteor hitting the earth for hospitals across the country. A lot of hospitals were not healthy financially before COVID-19 hit. Many, sadly, will probably never recover. But the enormous hit of revenue to our hospitals. Remember, a hospital works on a very small operating margin, a 1 to 3% operating margin. If you lose 3 months of revenue, it's not recoverable. And we had to make sure that the company had financial footing that was stable so we could come out of this looking like the organization we were before or even better. So we made a lot of hard choices there. So the other thing administration did was we furloughed thousands of people. Okay, we tried to match the supply of our teams with the demand that was coming from the community, which was at about 20% of normal. So we tried to be very responsible financially. We also decided that we needed to make financial cuts to keep the company going. And instead of, our whole goal was not to touch the clinical side of the house because we didn't know how long this would last, when people would come back for care. So we actually took about 18% of our overhead, which would be considered my job and other administrative costs, if you will. We took about 18% out of that budget, which was about $80 million. And that's deep, but we wanted to protect the clinical side of the house and the operating side of the house. So I think that's what we spent most of our time on, and also trying to set up that EROC council to, when ready, we are going to be prepared. Let's help the frontline workers come up with new and innovative ways to take care of patients with COVID-19, but keeping people that don't have COVID-19 safe at the same time. So we radically transformed how we deliver care and a lot of preparation for the recovery. So it was a team effort, that's for sure.
All right, Brian Nestor, President and CEO of Lehigh Valley Health Network. Thank you for your time.
It was wonderful to be on. Thank you for your invitation.
PCN brings the distinct aspects of Pennsylvania and its residents to your favorite screen.
Hear from state government and community leaders during unedited, balanced coverage of politics and policy.
Dig into the rich history and culture of the state, presented by notable residents and historians.
Score a view of the best high school, college, and world-class athletes competing across the state, and much, much more.
Start exploring the Keystone State today on PCN and the PCN app.
I'm here with Susan Dickinson, Director of Unemployment Compensation Benefits Policy at the Department of Labor and Industry. Thank you for being with us today.
Thank you very much.
So to start off, can you go through some of the different programs that are available for people to apply to? I know there's PUA, PEUC, regular UC. Can you just describe the distinction between these programs and what options are available to people to apply for unemployment benefits?
Sure. So the first and foremost, we have our basic unemployment program, the program that we have, year-round every year. And that is the primary program that someone will be on if they can qualify for the program. There are a lot of different qualifications. There's a a monetary qualification where you had to work enough in the last year and a half or so. And then there's also qualifications such as the reason you're unemployed. So that would be the first program that someone would file for, and we would check their eligibility on that program. After that, we have the PEUC program, which is part of the Federal CARES Act, and it's really just a 13-week extension of regular unemployment. So once someone runs out of money on their unemployment claim, they'll have this additional 13 weeks available to them. The additional 13 weeks is also for anyone whose benefit year has ended. So on a regular unemployment claim, your benefit year, it is a year. Your claim is good for a full year, and you can't open a new claim until that year has expired. So those claims only have about a half a year's worth of money on them, though. So if you are unemployed for more than half a year, you would run out of money. So this additional 13 weeks adds some, 3 more months to that time frame for individuals. Starting in about 2 weeks, Pennsylvania has also triggered onto an unemployment period. Our unemployment rate has gone high enough that a program is activating called extended benefits. Normally, this is a 50-50 shared program, federal funding and state funding, but right now it's being fully federally funded. And it is another up to 13 weeks of benefits for individuals. It will be a variable amount depending on the person's length of their regular unemployment claim, because unemployment claims can vary between 18 weeks and 26 weeks. So the extended benefits is half of what the person received there. So it'll be anywhere from 9 weeks to 13 weeks. And so that is an additional extension. Once the PEUC is exhausted, then they would move on to extended benefits. And then completely separately from them, those programs is the PUA program, also part of the Federal CARES Act. And that is up to 39 weeks of benefits for individuals who don't qualify for traditional unemployment. So that could be because they don't have enough of a work history, or perhaps they are self-employed or an independent contractor or a gig worker, and they would be eligible for the PUA program for up to 39 weeks of benefits. Finally, on top of all of those programs, no matter which type of benefit you're receiving from any of those 4 programs, you'll also receive an additional $600 payment for every payment you receive. That's called the FPUC program. It was active for the first week, April 4th, and it runs through July 25th. So it will be over in about 5 weeks. But the FPUC is, available for anyone who receives any form of payment on any other unemployment claim. It doesn't have to be a full payment. You could be working part-time and only receive a partial payment. You'll still receive your $600.
And is the application process different for the different programs available?
The application process is different. Generally, all applications are online, even though they may be different kinds of applications. The only program that does not have an application so far is the FPUC $600. That's nothing that anyone has to request from us. We just make the payment to individuals. The extended benefits program hasn't started yet, but it will in about 2 or 3 weeks. And that also doesn't exactly have an application process. It's just an additional extension that's set up after someone exhausts the last money on their PEUC claim. But the other kinds do have online applications, or for people who don't have online access, they can call our various phone numbers. There's a call center for PUA, and then there's a call center for regular unemployment and the rest of the programs.
How is your department addressing fraud and scammers trying to target claimants and the programs?
We have a fraud unit who does investigate any type of claims that seem suspicious, and the most common anymore, not just during the pandemic, but even prior to that, identity theft is more and more common. So they'll work with individuals if they've identified a claim being filed in their name that wasn't them, and they'll make sure that they have the right steps to take. They have to file a police report and then provide that to the department so we can disassociate the claim from their identity. So what we've done, especially with the PUA program, because that is an issue not just for Pennsylvania, but nationwide. Every state's PUA program is being hit with identity theft fraud. It's not something that the systems of the states have been breached. It's not like the fraudsters are getting information from the system, but they've gotten information elsewhere and they're opening claims in people's names. So what Pennsylvania has done specifically is move all of the payments from an electronic form to paper. We did that at first. We switched everyone over to paper checks because the fraudsters were so good that they actually had people's real addresses on there. So as we were sending checks to people's real addresses, they were receiving them and saying, I didn't file for unemployment. We've switched over to debit cards, and I think we're almost done switching everyone over to debit cards. And that also, has the same type of safety with it because the debit card has to physically get mailed to the person. So now people are receiving debit cards and saying, I haven't filed for unemployment. So that has actually helped tremendously. We realize, it's inconvenient for people who do want to have direct deposit, but it is a very good thing that we have not let the payments go to the fraudsters' bank accounts directly, and that they are getting diverted to the real individuals who are able to turn them in.
As you mentioned, we're dealing with a large volume of unemployment claims. From the time that someone applies, how long would you say that it might take for them from the time that they apply before they receive any payments?
So if a person doesn't have any type of issue on their claim, it's what we call a clean claim. And that claim goes right through the system. And, if they start filing for their payments, they get their payments and everything is seamless. So there's no human intervention needed for a clean claim. So the way that regular unemployment works is once you open your claim with us, it's kind of your signal to us saying, hey, I'm unemployed now and I'm going to be asking for payment. So at the time you open your initial claim, we send you information, we gather information from you, we sort out any issues, or at least start sorting out any issues. And then what the individual has to do is every 2 weeks, they have to go into our system and certify and say, yes, I was unemployed those last 2 weeks and I'm seeking payment, pretty much. So, that is a part of the UC law where you can't file for benefits ahead of time. It has to be after the week has passed and you've been unemployed. So as soon as a person can do that, it's typically the second Sunday after that they open their claim, and they can file that day. And if they file Sunday, they generally get their payments by Tuesday or Wednesday. So it's pretty fast. Now, if someone has an issue on their claim, completely unrelated to the pandemic, it might take 4 to 6 weeks to be able to, sort out an issue, especially if you have to go back and forth between the claimant and the employer, and you have to, get both sides of the story and figure out what the issue is and how it should be resolved. Now, with the pandemic, of course, there's a longer wait, and there's no specific defined time, but it does depend on the person's issue. Issues like that where you have to talk to two parties, the employer and the claimant, do take longer. If it's just an issue where we just need more information from the claimant, that wouldn't take as long.
With counties starting to open up across the state, what should people do when they're returning back to work, maybe only part-time? Do they have to change their claim, or will they continue to get it the same way they were before?
If someone goes back part-time, all they'll have to do when they file their continuing claims is report their gross wages to us for that week. If it's someone on a PUA claim and they are self-employed, they report net wages, but everyone else reports gross wages. And what we do is we just deduct that amount. There's specific calculations in our benefit rates. There's something called a combination rate, and every person's is individual to them. So they'll have it on their financial determination. And when they report wages to us, we deduct the wages from their combination rate and they'll get the difference.
And finally, as new programs keep coming out and as new information keeps coming out, how are you as a department getting that information out to people?
So a lot of the programs that we have, especially the ones from the CARES Act, they do have required notification guidelines for the states where we do have to, we're required to send information to individuals who may qualify. So we've followed those federal guidelines. They allow for email or mail. It's up to the state. And what we'll do is we'll just gather anyone who might be in our records who might be eligible for that program. And, we're able to then notify them. We usually do a one-time mailing, and then we have an insert. I know we have a CARES Act insert that goes into every claim confirmation letter, so everyone's aware of all the different programs that are out there. We also have so much information on our website for people who do have internet access. We update our website daily, it seems. There's always something new or something changing that we want to communicate out there. We use social media as well. So we'll put information on, Facebook or Twitter and try to keep individuals updated. And as time goes on and we get more claimants, we update our email lists, and we will communicate via email quite frequently. And mail when we need to if someone does not have an email address with us on record.
All right, Susan Dickinson, Director of Unemployment Compensation Benefits Policy at the Department of Labor and Industry. Thank you for being with us today.
Thank you very much.